Okay. How will the Affordable Care Act affect you and your own office or area of business, and what changes will it have on your life?
Okay. It probably won't have, in the short term, it won't have a huge effect on my patient population that I take care of. From that standpoint, I think what's going to happen is if the 50 million people or whoever that now have insurance or can go to physicians, there's already what I consider a relative physician shortage, meaning most physicians are working pretty hard, taking care of probably close to the maximum number of patients that they can, particularly from a primary care standpoint. I'm kind of a specialist, so they may not have quite that saturation in all specialties. But all of a sudden, if you open the floodgate and say, here's 50 million more people that need primary care, and obviously all kinds of care beyond primary care, that's going to really, be a supply and demand issue. And I'm not sure we're set up to provide that. Now, you can step out a few tiers and say, okay, well, then we'll have physician's assistants or maybe nurse practitioners that are fulfilling some of those roles. But the problem is we haven't ramped up as a country to provide health care. We've actually probably lowered the amount of people in health care indirectly. Medical schools may have increased a little bit in terms of the number of physicians that are being trained, but we've also changed the demographics. A lot of women are in medicine, which is great, but about 50% of women practice full-time. I mean, it's actually probably less. Probably of the women that practice, that accounts for probably half of, if 50% are what they can actually, the supplies that stand up. You know what I mean?
Sorry.
So if you train 100 women, they're probably 50 of the women are really, they're providing 50%, not 100%, because a lot are part-time, a lot go into practice and then stop when they have families, which is certainly understandable, but it's hard when you're trying to provide ongoing care and you're going through a lot of training for those people. Obviously, on the male side, there are probably more that do practice because they're not going to be as much raising the family. The other is physicians probably in general retire sooner if they can, so they get frustrated in some of the practice of medicine, and so I don't think you have as many of the doctors that are practicing well into their 60s or even 70s, so you have an earlier retirement. And then the physician practice changes because a lot of physicians, after a period of time, they say, okay, I'm kind of tired of this part, and they go into maybe more of an administrative role, or they work for a company or as a consultant, or they practice sort of more part-time. So again, you're talking about all this sort of manpower that's shrinking, and you're not really increasing it, but now you're talking about a growing patient population. Some of those patients already get care anyway, so the 50 million, it's not like 50 million, but 50 million don't typically have primary care. They get their care through the emergency room and things like that, which isn't really providing primary care. What changes on my life? I just think it's more, not so much just how we're going to pay for it, but just making sure we provide it in an efficient way, and it's not just another, sort of government-run program that goes, starts with a good intention, but just kind of runs amok and becomes very expensive and doesn't really do what we were hoping to do.
How do you think the Affordable Care Act will affect our nation in the long run? And what do you envision will happen to our nation because of it, and why? How do you think the Supreme Court will rule on the Affordable Care Act?
Well, I think there needs to be healthcare reform, and obviously this is the current ultimately, by providing that care, you're going to, and engaging the patient, you're going to provide for their better health, and hopefully, if they're in better health, they ultimately use less resources to some degree, particularly if you think of it from a preventative standpoint, and incentivize that preventative standpoint. What do I envision happening? You know, I think we are one of the few outlier major world players who doesn't really provide care for their population. So I think we're certainly an outlier. We've let sort of the private sector, to some degree, I mean, the public is still a huge part with Medicare and Medicaid, but the private plays a significant role. Some would argue, well, the private just can't do it because we still are kind of struggling with it. But somehow there needs to be some compromise. And again, whether that's a tiered system where you have sort of a baseline coverage that's provided through our government to everybody, but it's tiered, so here's the baseline, this is what everyone's, gets. But if you want above and beyond that, then you pay for above and beyond. Obviously, there's then it's, some people can afford better care, but the reality is that's how it is in a lot of places, and it may be what ultimately happens here. I think the Supreme Court will probably still support the Affordable Care, just because I think the principle of it is probably is good, whether the way it's written, and my understanding is it's, 4,000 pages or some crazy amount. So I just read the Steve Jobs book, and every simplicity is was his theme. I mean, he tried to create simple products, and he believed in very, simple, somewhat simple ideas. His ideas were amazing, but I'm just saying it amazes me when you come up with something that's, thousands of pages or hundreds of pages, and we're trying to put a system into place. I don't know how you can do it. I mean, it's obviously so complicated, and there's so many exceptions and inclusions and variations that it just gets too hard to do. So I think just hearing that tells me you have to somehow simplify it, and whether that is a tiered system with some universal coverage, which in some way this is sort of mandating, that's potentially what it's, where it's going to what it's going to come to.
Do you believe that it's the government's role to provide health care for most, if not all, of its citizens? And do you believe it's the government's role to set rules and regulations on the kind of health care people can have, or should health care be a more free market system?
Well, I've probably answered some of that in what I just talked about. Unfortunately, you probably do need the government sort of saying we all need health care, because I don't know if we can really rely on, all of us to make that decision. Meaning, if we're healthy, do I want to spend that money there, or go on a vacation, or get the new car, or whatever? And unfortunately, we make those choices, and the problem is we don't always get to choose when we're healthy or sick. So it's probably their role to, whether they're providing it or requiring it to some degree, and then it's purchased in the private sector, that's kind of to be determined. The rules and regulations, I think we have to be careful. There might be a baseline, like saying this is the baseline coverage, certain catastrophic, certain primary care, certain preventable type stuff that would be important that people have. So that, but beyond that, I think then I would let the free market system sort of determine, if people want to add to that, they probably can't subtract. So again, there's a sort of baseline level of coverage, which makes some sense, and then adding to it would be something that potentially they can do through the, public sector, if that's provided, or So I'm definitely a promoter of the free market system. It's hard to imagine a healthcare provider if we were all just employees, essentially, providing care within a system. I think you get much ultimately better care, and the innovations that come from in the advancement of healthcare come from people having an incentive beyond. Sure, we want to help people and take care of people, but you want to have a little bit of the entrepreneurial side where, you know what, if you come up with certain ideas or you do a better job, you're rewarded in certain ways, and not just everyone is, right in the center of the bell-shaped curve. And I always say you're only as good as your weakest link, and I think that, if there's some that are better, they should be rewarded, and if some aren't as good, they should probably have the other effect. And the free market does that. The public sector, I think once you're in it, it's sort of like a big union. It's like you're protected, and you're going to probably end up with a mediocre system